The inquiry into the government's response to the COVID-19 pandemic has found it was not as effective as it could have been, declaring public trust has been eroded and that there are lessons to be learned for the future. The inquiry has made a number of recommendations to help in future pandemics, noting the next one may involve a more lethal virus, which is harder to contain. The inquiry looked at the provision of vaccinations, aged care, disability care and international border closures. It didn't look at actions taken unilaterally by the states and territories, such as vaccine mandates or state lockdowns. It found attempts to achieve a nationally cohesive approach fell short, with inconsistencies in the pandemic response among the states. That allowed confusion and mistrust to develop. Recommendations include the government addressing critical gaps in health recovery from the pandemic with additional mental health support and for the establishment of a national centre for disease control.
The CDC should give us the capability as governments and communities to have a good evidence base for making decisions that, for example, impact children and young people, that balances risk and benefit, that takes account of non-health impacts, particularly the mental health impacts, which is a recurring theme of this report. So I think the nature of the report, the measured way, which in no way pulls punches, that the panel seeks to direct us for the future, really vindicates the way in which we design this report or this inquiry.
The report has also found economic policy wasn't in line with health advice, with Treasurer Jim Chalmers saying poor policy choices unnecessarily affected inflation.
The modelling cited in the report says that the extended policy support, which didn't always move in line with the health advice, meant that peak inflation was at least 2 percentage points higher than it could have been. On the design of the economic response, we saw some very good ideas badly implemented and poorly targeted. Labor called for and supported programs like JobKeeper, but we were very, very clear at the time that the support should have been rolled out faster and that it should have been better targeted.
Let's go to political reporter Evelyn Manfield, who's in Parliament House, for more on this. So Evelyn, what reflections did the report make on the pandemic response?
Hi Ros, look, it's a big report, so bear with me as I sort of get through different elements of it. But one of the things that stood out about reflecting on the COVID-19 pandemic was the experts said it was like trying to build a plane while flying it. So there were certainly aspects of Australia's response or plans that were in place that just didn't exist. A couple that it really pointed to were international border closures, that there wasn't adequate planning there, and also quarantine systems. Not enough planning there. But it did point out that Australia, while it could have done better, it did fare well in comparison to other countries around the world. It did also reflect on aged care. Of course, there was a devastating experience for older people who were living in aged care homes. Of course, you know, the death toll around the country in aged care homes was quite high. So it did look at that and the staffing issues, and that there were problems with trying to get that surge workforce in place to be able to adequately staff aged care homes. Also a reflection on elective surgery, saying that years on from the pandemic, there are still flow-on effects to elective surgery that was a result caused by the pandemic. Another interesting thing was talking about the broader impacts beyond the health response. So like you pointed to, the social and mental health impacts, and just making sure in a future pandemic that that is really communicated clearly to the Australian public so they can understand why those decisions are made. Another interesting reflection as well was on the vaccine rollout, saying that delays in procuring that and distributing it further complicated by some concerns in the public about some side effects of the COVID vaccines, saying that that did prolong lockdowns in certain parts of the country, with a direct economic cost estimated to be at around $31 billion. So this really was a broad report. It's been happening for a year and looking at all those different elements in response to COVID.
So what happens next, Evelyn?
Yeah, look, there are a couple of big focuses. One was on trust, which was really interesting. The experts that we heard from today saying that don't take that for granted, saying that Australians did really put a lot of trust in government to begin with, obviously following things like lockdowns and all those sorts of measures, but then that eroded throughout as the pandemic went on, saying that in future governments really need to explain as clearly as possible why they're making those decisions, especially when those decisions are different to what other countries around the world are making. So that was a really key feature. One of the interesting quotes was, "Trust has been eroded and many of the measures taken during COVID-19 are unlikely to be accepted by the population again." So quite a strong quote there. So 19 immediate recommendations to be enacted and then some more medium-term ones as well. But one of the big ones was also establishing a CDC, so a Centre for Disease Control, saying that Australia was the only OECD country that did not have that in place. So that was a focus from the federal government and the Health Minister, Mark Butler, there today, saying $251 million going towards establishing that, and saying that next time, we do know, we've heard from the experts and the politicians today saying that there will be a pandemic again in the future, and next time that happens, we can't say it's unprecedented. So making sure that there are the bodies in place to be able to deal with that, and making sure that there's that mental health support as well, particularly for children, was really an interesting focus of the report too.